Hello, everyone. Thanks for joining our session today, Doing More with Less. See how NJRA leverages technology to increase mobile workforce efficiency. My name is Aya Fozzi, and I'll be your moderator for today. I'm so excited to announce our speakers. Matt Fairhurst, CEO and co-founder of Schedulo. Matt brings over 10 years of product and UX experience. Prior to founding Schedulo, Matt held a number of leadership roles in marketing, consulting, and design in the enterprise software and manufacturing sector. And I'm really excited to announce our guest speaker, Greg Pino. He's the Vice President of Operations and Sales at NJRA Respiratory Associates. He primarily focuses on integrating technology solutions to both operate and grow more efficiently. But before we get started, we have a few housekeeping items to go over. A link with today's recording will be made available to everyone after the webinar, so just sit, relax, and enjoy. If you have any questions for our speaker, please submit your questions by using the chat console on the GoToWebinar. We will get to all of them at the end. And without further ado, Matt, take it away.
Thanks, I really appreciate it, and good to be talking to everyone, and a special welcome to Greg for joining us from NJRA. Really looking forward to hearing more about your story. It's one of the customers that we love and a use case that we love as well, and we work a lot with. So looking forward to digging deeper on how you guys are using our product and how you're using Salesforce and how it's changed the way that you're running your organization in the field. But before we get down to that level of detail and we bring Greg onto the call and on the line, I do want to just quickly give everyone a brief introduction into what Schedulo is for those that haven't seen our product before or used our product before. We're a mobile workforce scheduling application and mobile application that helps businesses and organizations with people in the field dispatch, allocate, and schedule work to them. And then we have a mobile product that helps those workers in the field receive notifications and then get work done, whether that's an inspection or an audit or an in-home visit or a training event, or more traditionally something's broken down, they're going to fix something or install something. So we work with many different types of customers and solve these problems from, I guess, finding the right person and with the right skill set and the right availability for a job during that first moment of service when your customer or a stakeholder of some kind, either internal or external, has initiated the request to a business to say, hey, I need some work done in the field of some kind. Can you send someone out to do it, or can you send multiple people out to do it? All the way through to finding the right person, and then like I said, the mobile side of completing that work in the field, ultimately hopefully delivering a wonderful customer experience for that business's end customers. And we work very closely with enterprise platforms and ecosystems like Salesforce.com. We've worked with Salesforce for the last 3 years, and many of our customers use our products in very tight combination. And we recognize that scheduling and mobility generally as a problem is not isolated from the rest of the business function. So it's incredibly important for us to have tremendous flexibility and scalability on the Salesforce platform so that our customers that use both can solve really interesting, complex problems. And I'm sure Greg will talk a little bit about how NJRA have used Salesforce and Schedulo in combination to solve some of their workforce problems. So thanks for allowing me to introduce our company and our product, Greg. Really great to have you on the call. I know that you're on the East Coast, I'm on the West Coast of the US, but really appreciate you taking the time this afternoon to have a chat with us.
Thanks for having me.
You're welcome. Love you to introduce NJRA and what you guys do, how you do it, and tell me a little bit about your organization.
Sure. So New Jersey Respiratory Associates, we provide skilled nursing facilities with what we call a 24/7 on-demand respiratory department. We provide them with respiratory therapists, all the equipment and supplies they need to take care of their patients, in-servicing education for their staff, and also program development and marketing so they can take this program that we're giving them and show it off to their referral sources, being hospitals and patients around the community and physicians. We're a small family-owned company. My father started the company in 1982, and we've always embraced being a smaller company. But with the implementation of things like Schedulo and along with Salesforce, it's kind of tested that a little bit because we've really transitioned from a very manual customer focused company to still being customer focused, but being almost completely automated to where we can really scale beyond where we've been. So that's why this has been a really exciting opportunity to work along with Schedulo, with a company that's been around for 32 years, pretty much doing the same thing.
Yeah, that's awesome. And are you mainly servicing New Jersey and New York State, or is it fairly is it broader than that geographically speaking?
It's really not. It's we're just in New Jersey, and I guess our name kind of limits us to New Jersey, but there's about 365 skilled nursing facilities in New Jersey, and we currently work with 90 of them. So, for a small company, we have a big portion of the market.
Awesome. And, I think, leading into some of the challenges that you mentioned there, or some of the challenging around your thinking in terms of scale and what technology has allowed you to do, if you think back to when we first spoke and when, my team was first sort of introduced to your use case, what were the challenges that you faced back then? How were they different to like 1982 when your dad started the business, and how had they matured to that point? And what were the real pains that you were experiencing when we spoke a few years ago?
Yeah, I talk about this being there's our known challenges and then our unknown challenges. And at the time, our known challenges were routing our therapists. Our therapists have a group of facilities that they respond to. So they're not in one building one time a day. They might go around to 5 to 8 buildings a day. So routing the therapists at the beginning of the day and then rerouting them as new patients come in throughout the day. So that process, both in deciding where to send that therapist and then communicating with that therapist where to go and who to see at that facility, was a huge challenge. And really, there was a long way for us to go to become, really efficient at it. We were using Excel spreadsheets, we were using fax machines, and we were calling them almost, 10 times a day to reroute them and tell them where they'd be going next. And that was what our known challenges were. What our unknown challenges were realizing that the communication alone was holding us up in terms of how they were interacting with those patients, what they were seeing on those patients. They would fax us, that patient form once a month at the end of the month to show us what they did on those patients. And not having that information at our fingertips in real time really held us back to see how we should be changing our program to better fit the patient's need. I laugh now because we're a small family-owned business, but a lot of the decisions we make since we've implemented Schedulo are data-driven. And who knew that like a small company like ours could be data-driven in terms of how we're routing our therapists and how we're making decisions in terms of new programs to roll out and seeing what our customers really want.
Yeah, that's awesome. And I mean, surely they were challenges that you were able to identify and begin to solve, or at least begin to look to the market around what technology was available, to help solve them. I assume when your dad started the business in the 80s, it was a paper run sheet or, something like that. And you would send them off at the start of the day and presumably not hear from them until the end of the day when they came back, and they were totally disconnected as workers, right?
Yeah, I mean, that was back in the day when, there weren't even cell phones. And then, when cell phones came around, we were still writing things on paper. And then once we got our first computers, that's when Excel came in, and, that was a huge move from just written paper to Excel. But, the leap from paper to Excel was nothing compared to the leap from Excel to Salesforce and then ultimately Schedulo. It just doesn't compare. And to be honest with you, every time we've made one of these leaps, you just wonder how you were able to operate before. And it really is amazing. Yeah.
Yeah, it's certainly a wonderful thing about the category that we build technology around. I think, we have a great appreciation that the businesses we work with often have been solving these problems for, decades, if not centuries. People have been moving around in the field, and and getting things done at a transactional level. And it's not like there's this new category of technology waiting or growing with this emerging market that's somehow suddenly sending people out into the field. They've always been there and they've always existed. There just happens now to be a category of technology, and I think a convergence of mobility as well, with mobile technology really exploding in the workforce and everyone having a smartphone. It's been a pretty amazing thing to see, I think, over the last 5 years in particular. And it's one of the reasons we love this space, is being able to cater for so many different types of companies that have been doing this for a long time, just not using technology to actually help solve that problem at all. So, thinking about that decision-making process, you obviously, we're going through a transitionary period, and moving from paper to Excel was the first step, and we see that quite a bit. How did you then sort of go about, either through looking at what you were doing with Salesforce or looking at solving a scheduling problem first and foremost? How did you go about the process of finding a solution, ultimately Salesforce and Scheduler together, to address some of those challenges that you were seeing?
Yeah, and I think this was more of a luck thing, because looking, I spent a few years just working in the business and figuring out how everything works operationally. And if you don't know that, it's hard to implement any type of solution that's going to really make a difference or be effective over the long term. And I think what we pinpointed was, yeah, we knew scheduling was a big problem, but if we first didn't organize our customers and our patients and our contacts into one single system, then first moving and addressing scheduling just wasn't going to work. And that's kind of what led us to Salesforce. I can't say enough about Salesforce just being probably the perfect tool that's leveled the playing field for small companies competing against larger companies. I look at some of our competitors today, and the larger ones, they're still using fax machines. They're still using Excel templates because it's harder for them to make these sort of implementations. And we've been lucky in that regard. So we started with Salesforce, and once we onboarded everything onto Salesforce, actually Salesforce recommended Scheduler to us as we were talking to them about our scheduling problems. And then it took about a good, probably about a month to work with the team at Scheduler to really design something that we were looking for that would address our problems. And that wasn't, again, you come out with your version 1 and it addresses, 50% of your problems. And then you come out quickly with your version 2, and that, makes the gap for maybe that 90%. So it was a process. But, you need to, nothing is going to be perfect the first time you do it. And it's probably better that it's not perfect. So you can kind of try one thing and then make those tweaks to make it address all of the issues that you're having.
Yeah, that's certainly what we've seen as well. And, certainly as a software and a technology company, we have a very similar approach to the way that we solve problems, is sort of in an agile way, looking at the problems and the challenges that we're trying to address, and really trying to find that minimum viable functionality that can address that need and address that problem, but more importantly, be tested against the theory that we'd developed, or the thesis that we developed. And I'm sure you were doing the same, and it's our encouragement to most of the customers that we work with is to take this sort of iterative and learning-based approach to the way that you adopt and implement and expand technology within a business, whether that's Salesforce or something like Scheduler, or something in your marketing department. I think that approach is always really sensible, and it was good to work with you in that way as well. I think those customers that have a propensity to iterate quickly and learn quickly are always the easiest to work with when you're talking about getting software up and running and live. And as you mentioned, we've worked very closely with Salesforce, and often we do get recommended as they're working through more of a customer relationship or patient management or provider management type problem with you, identifying other applications like us that can then complement that functionality. And I think you kind of hit the nail on the head there around how much it has changed the game. And I think enterprise platforms generally, and sort of SaaS-based and cloud-based enterprise platforms, are really changing the way that customers can adopt and then iterate with technology in their companies like they never have before. And it's such a wonderful system of record, of patients and customers in your case, but also a great environment for you to take, what is, native functional applications, and in our case, highly functional applications in the field, take the data that we work with inside of Salesforce and then use all of the really rich customization and configuration and workflow and business logic components that Salesforce offer to really extend upon that as well and solve, end-to-end problems, not just a functional problem within a business that's somewhat disconnected. And that's always really exciting to see. I think customers go from, start to finish on a native platform and see true benefit from the technology they're using. How did you get the team on board? So as you were sort of exploring these options and then implementing the technology and working with Salesforce and working with us, obviously, as you mentioned, the leap from Excel or paper or Google Calendar or something like that to a structured and highly functional scheduling tool, plus Salesforce and having everything structured there as well. How did you convince the team it was the right move, and then what were the things that they saw that helped them sort of fall in love with the decision you'd made? Likewise.
So this was one of my bigger challenges that I think, everybody likes to think that, the workforce is a bunch of millennials that can adapt very quickly to different technology. And that just wasn't the case for us. A lot of our workforce just, technology is almost like a second language, and, they have trouble or resist to adapting to it. So our approach was to work slow with them and talk them through the inefficiencies and show them, let's talk about a different way to do this and a better way to do this. And slowly kind of roll it out piece by piece. So we started with just Salesforce, and we started, organizing patients on Salesforce, and then they realized, wow, this is really, I can't imagine doing it the other way. And then after that, we implemented a scheduling platform with the goal of them initially saying, okay, it might be a little harder for me to learn at first, but in a month, the old way of doing it is just going to seem so antiquated that, I'm going to be happy that I spent a month learning it. So that was our biggest challenge. And it remains a challenge as you onboard everybody. But as long as you, and for us, as long as we explain to both our mobile workforce and our therapists, showing them that, specifically in our case, they were getting 10 calls from the office a day. Now they get one just to, check in and see how things are going, because they can communicate with real time over the application. And the same thing goes for our administrators working in the office, having to go to the fax machine every 10 seconds to get a fax and manually inputting into the computer. Now they're literally just seeing what comes in over in our cases and, and overseeing what's going on in the field rather than having to make a phone call every 5 seconds. So as long as you can continually show them what kind of impact the change has made in their job and how it's made their life easier, we were able to get everybody to accept it and take that, that 4 weeks to really learn how to use the system and make their life easier.
Yeah, that's great. And I find it always really interesting, because one of the theories we had when we started this company and built this product was, scheduling and dispatch and making those decisions in the back office is always a really, really complex problem. And the user experience, although complicated, making that as easy to use and as seamlessly integrated, I think importantly to, systems like Salesforce, and more importantly, the business process that's happening in Salesforce to initiate that work is key. But one thing that we kind of really wanted to do is think about that worker in the field, using his mobile phone, and everyone, even millennial or not, or, regardless of age and regardless of the type of worker, for the most part, they're going to use other applications on their phone, and they become comfortable with, Facebook or email or making telephone calls or looking at Instagram and looking at all these other consumer products. And, for slight for some demographics, that's not so much the case, but certainly for the large majority of the workforce, it is. And we knew that, regardless of that, making sure that our mobile product was as easy and as wonderful to use as possible, and the user experience on their mobile app was the best that we could possibly make it, and that's a constant challenge for us, was one of the critical factors to helping our customers be successful with the implementation of our technology. The ratio typically between back office and front office for us is anywhere from 70 to 95% of people that actually use our product are the ones on the mobile device. So it's really important that group of people love using the product. And I'm really interested to know, although efficiency and helping them make money or helping them save money and get things done really faster and more efficient is important. How important was it for them that they had a really easy to use application that they could kind of roll out of bed and just quickly fire up and off they go about their day?
It was extremely important. And it was extremely important to me too, because, as the manager of and implementing a system, you don't want it to fail. And the easiest way for it not to fail is for them to know how to use it and be able to use it easily. So it was important for both of us, and we've actually, as a company now, gone through, your version 1 of the app, which was extremely easy to use, to now the second version, which is even easier.
Yeah.
And it's been nice to show them easy and then easier. So, they're more accepting to, when something new comes out, they can look at it not as, something they have to learn, but something that will make their life easier.
Yeah. And that's a constant challenge for us, I think, as a technology team and as a group of, or a product company, is to think, let's not build an application and let it stagnate. We're always thinking of better and faster and quicker and far more usable ways of implementing our product and putting it in the hands of those that use it. So really excited to hear that, our iterations, just like yours, are proving to be successful in the field. I know that you guys have done a lot around some of our really interesting technology that allows customers like you to build out forms and processes and mechanisms to collect data in the field. Can we quickly touch on that and why was that really important to the kind of work that you do in the field? Some businesses are happy to just transact through work and check in and check out and collect a signature and complete the job and off they go. Of course, all of that is happening in Salesforce, so you get a full picture of what's happening in the field. But for you in particular, why was building out forms and processes on our mobile technology really important to the team in the field?
So there's two reasons. First is every job that our therapists do was a little more unique because there's almost mini jobs within that job. So every facility they went to, they could be seeing multiple patients. And we wanted to know specifically how they were interacting with those patients at the facility. On top of that, we're in the healthcare field. So we want to gather as much data as we can to see trends that can better our outcomes with this population. So we want to see, okay, this patient's at risk of potentially being readmitted back to the hospital. So we want to either write a note or notify us so we can put that patient on a watch. We want to know when we're doing education with patients, and does that have any effect in their readmission rate or them going home sooner. So the custom forms, aside from just enabling this to be customized more towards our business of having jobs within a job, or patient appointments within a job, also has enabled us to continually change the way we capture data. So we've made multiple changes to the forms since we've implemented them, as we see different data that we want to collect, or as we change, or as we implement new programs and say, okay, with this type of patient, we want to fill out this type of assessment, so we can put an assessment form within that patient form. So it just as customizable, Salesforce allows you to be on its own platform. This is just another extension of that, where we can just continually change how we're collecting that data and analyze it to fit our kind of ever-changing programs.
Yeah, That's really awesome. I think, it really kind of, again, sort of speaks to why we implemented that technology. We saw that, customers all the time are extending Salesforce or extending their systems of record and adding functionality and workflow to represent, complementary data capture or complementary business process that may or may not have been, relevant or the core problem that they're solving, but because you have this amazing system of record that allows you to report and drive workflow from and run your business on, an ability to say, hey, we recognize that a job from a scheduling point of view is someone going somewhere and doing something, but in reality, we also need to answer that question of what do they do when they get there? And in your case, it's seeing multiple patients, and how does that relate to data in Salesforce and patient management, and what's their relationship to the clinic or the facility? And then often we see, something similar to what you're doing as well, where data capture, that capturing information and data points in the field as they happen, from an auditing or an inspection or just simply collecting information that's important to the business is concerned, is really exciting as well. And often that flows into other sort of downstream processes that can be built out, or other applications that could be added on in Salesforce that handle billing or invoicing or payroll or whatever it is. I mean, it's really exciting to see how that mechanism to capture data in the field really efficiently, whether you're online or offline, is being used.
And,
so maybe,
and just to add to that, just for a second, what we're seeing, especially in healthcare, what you're seeing now is customers kind of demanding you to show them the value that you're bringing them. And one of the biggest complaints in healthcare is, if you're staffing, well, how do you know the staff that you provide to a facility isn't just sitting around doing nothing? And these forms and these different interactions have enabled us to have our employee documenting what they're doing, so then we can in turn show the facility that this is what's going on during the day, this is the value that they're bringing, and this is what they're doing, almost in an automated way. So it's not like a conversation we have to have with them every 6 months. It's an automated report we can send to them as often as they would like it.
Yeah, that's really cool. So tell me a little bit about, now that you're well up and running, and you've iterated with our technology, and you're iterating with Salesforce and improving things in the business. What are the, if we really get down to the meat and potatoes of any kind of business discussion and why you adopt technology, what are some of those quantitative results that you've seen out of this, out of the last few years, and these projects that you've been running and the technology you've adopted?
So, I mean, it was perfect timing for everything. I mean, as a 35-year-old company, we're currently growing at a rate of 20% a year, which is pretty good, considering that we're a small company. And that's kind of what I touched upon in the beginning of, we're really being tested to see, okay, do we want to remain a small company, or do we want to really scale this out to what it's capable of doing? In terms of our workforce, we've seen almost a 25% increase in terms of the area a therapist can cover. So, we would have a therapist covering anywhere from 12 to 15 accounts. Now we have one therapist per 20 accounts, and that's just on better routing. In terms of our back office operations, we haven't had to make any changes to those operations. When we started off this process, we had 50 facilities in New Jersey. Now we have 92. And without having to add a single worker in our back office administration, overseeing all this is just incredible.
Yeah, that's amazing.
So yeah, I mean, just in those two things alone, and then in addition to being able to make really truly data-driven decisions based on hiring, based on going after new customers. Based on programs we're launching, it's really just been an amazing experience.
That's awesome. One thing that I really love, we work a lot with the healthcare space and the nonprofit space in solving these kind of challenges. And one of the things I love about this sector in particular is, it can be somewhat non-competitive, and in your case, you are focused on a very, very small geographical area, in respect to the rest of the country. And the propensity and the ability to share learnings and share knowledge across the industry with other people that are going through similar challenges has seemed to me at least a little more open. So would love to pick your brain and see if there was any advice that you were going to give another organization, maybe on the West Coast, that was going through what you were going through at the time. What were your learnings and the key sort of areas of advice that you would give them if they were to come and ask you, how you've been so successful with this technology?
Yeah, I mean, I think there's a couple things that I would tell anybody getting into this, whether it be first implementing Salesforce on their way to hopefully implementing Schedulo, or already having Schedulo, or already having Salesforce and then implementing Schedulo. First is really to understand the workflows throughout your organization, and really have that mapped out. And then really learn about all of the capabilities behind Salesforce and Schedulo. Once you know those capabilities in your processes, it's a lot easier for you to work with the Schedulo team in developing a system that will work for you. And then the other major thing is, don't try to solve 100% of your problems. Try to solve 50% of them, try to solve 60% of them, and start there, because you're going to learn so much from just that 60% that it's then going to make it easier to solve the rest. When we were mapping this out and talking about it, we'd always have these crazy ideas for, like, this would be really cool if we did this, or this would be really cool if we did that. And we kind of had to hold ourselves back and say, well, let's take our time in doing it, especially in healthcare, because you're dealing with actual humans and their health and their outcomes. You want to always be careful and make sure that what you're doing makes the most sense for them.
Yeah, no, that's really awesome. Thanks so much, Greg. I really appreciate it. That kind of wraps up our discussion. I've really, really enjoyed learning a little bit more about your company. To be honest, I didn't realize the company had been around so long, and wonderful to know how long it's been in your family. I think that's a wonderful story, and super excited to continue to be working with you. Thank you for talking about how you adopted technology and some of the challenges you went through and the decision-making process. It's been really, really educational for me, and I hope all the listeners on the call are getting something out of it as well. I am happy to hand it back to you if we have some questions for either myself or Greg, or collectively. Let's make sure we answer them before we wrap this up.
Awesome. Yeah, thanks, guys. Greg, that was awesome. Thanks for walking us through your journey. I want to turn it to the audience. If you guys have any questions, please chat it over. We do have one for Greg right now. Greg, why did you choose a platform like Salesforce and Schedulo rather than an industry vertical solution? So instead of going after like the healthcare.
Sure. Yeah. I mean, it was kind of luck. We're a unique company, and no industry platform really fit exactly what we wanted to do. What I saw with Salesforce specifically was that you can kind of customize it to be whatever you want. A lot of the industry platforms are actually built on top of Salesforce, and a lot of people don't realize that. So that's kind of why I chose Salesforce. The other reason was it was HIPAA compliant, which obviously is extremely important, along with Schedulo, which is HIPAA compliant as well. So that's what led me to Salesforce. I didn't want to kind of follow the trend of what everyone else was doing, and I think that's made for the better, because with Salesforce, we're really able to implement managing our customers, managing our patients, managing our sales, managing our equipment, all of our supplies, and we're actually currently working on implementing it into our accounting system. So it could really be the foundation of which your entire company runs. And what Schedulo has been able to really build into that platform and keep it kind of native to Salesforce has been really amazing.
Yeah, that's really cool, and I think I can add to that as well. Aya, it's something that we see a little bit of in the industry as well. Not only in health, but other industries, where they've got sort of end-to-end industry vertical solutions that sort of do everything from employment management through to invoicing and everything in between. or, although like practically some of those can be wonderful and a lot of customers can be very successful. For those organizations like Greg, where they're looking to solve, these very complex problems like scheduling and mobility, sometimes, very, very broad but thin applications can, they just don't have enough substance in that sort of functional area. And companies like Greg's can take sort of more of a best of breed approach to the way that they're adopting technology. So using a base platform that gives you things like security and HIPAA compliance, and an ecosystem of applications that are built on top of it, and one consistent place to store your data. Then sort of adding sort of functional items that go very deep, and functional products that go very deep on certain areas. And in our case, scheduling and mobility is really interesting. Yeah, I think that's a fairly consistent story that we've seen across health as well. And I think, just like Greg mentioned, with customization and configuration in the enterprise, it is a reality that businesses need to go through. There are no two businesses that are exactly the same. And our sort of, I guess, approach, and I know that the approach of Salesforce as well, is to allow customers to let technology wrap itself around a business and how it works and how it needs to work to scale in the future, rather than forcing a company to kind of wrap itself around a specific piece of technology just because it sort of does everything end to end. And it's a very interesting sort of differentiation between horizontal or vertical solutions versus platforms like Salesforce. But excellent. So I think if there's no more questions, that was a really good question because it's super relevant to what we see as well. And I appreciate your answer there, Greg. If there aren't any more questions, happy to wrap this up. Greg and I, just let me know if there are any more questions there. But Greg, thanks so much.
We're good to go.
Excellent. Greg, thanks so much for spending time with us this afternoon. Really appreciate it, and really love your story. Look forward to touching base soon and continuing to help you and your team scale over time and really make the most of our technology.
Sounds good. Thanks for having me.
Thanks, everyone.
Thanks, everyone.